So I'm here today to tell you a little bit about the pain point that I saw every single day in the last 12 years of my education in medicine, and I left to actually try to solve this problem. This is the brain of a physician. They're faced with all kinds of pressures every single day and challenges, and physicians self-report they actually feel a lot like this dog on the right, where they're drinking out of a fire hose with information thrown at them and they're unable to deal with it on a day-to-day basis. 83% of physicians actually are thinking of quitting. They don't want to practice anymore. The burdens are too huge. The pressure is too high. The risk is too high. What I'm facing today is trying to meet this problem with a healthcare technology. The burden is immense. We have many life challenges facing us as physicians, where wait times are up to 3 months where you can't even take care of your patient. We need solutions that increase access to care. This is critical. More tools often ends up leading to more things for physicians to do, more pressures and less time to do it. What ends up happening is our medical education is shorter. We only have 1.5 years now in basic medical training. We have a shortage. Who's going to fill this gap? The question is, there's really no one left. We have a 20 to 90,000 physician shortage projected, as you all probably already know. And so the answer, I think, lies in a new set of care providers that has already started happening. We need to rethink the way that we're looking at medicine and stop trying to put a square peg in a round hole. We need to redesign the way that medicine is practiced, and try to actually meet the user's needs. Those users tomorrow are going to be nurses, nurse practitioners, physician's assistants, and caregivers. And actually, a big care provider will be technology. We need to embrace these changes. But you might ask, isn't medicine too complicated to have all these other users or these other providers taking care of patients? I would argue that it isn't, and I would argue that technology can actually often do a better job at taking care of patients than physicians can today. Won't this increase the cost of care? Well, today, less and less money is being put towards new drug development, new science, and new discovery. And the future of our practice, I believe, is actually going to be practicing better with the tools that we have, proving efficacy. Practicing better medicine, what does that mean? I saw day to day, every single day, a ton of waste. Why were physicians ordering unnecessary tests? We need to streamline care. We need to prove efficacy. There's a huge knowledge gap, and these care providers that are coming into practice can't meet this gap. We need to educate at the point of care, and we need to integrate our tools into their workflow rather than increasing the work they have to do. Remember that fewer hospital admissions increases the number of high-risk patients that are kept at home and that are kept in the primary care setting. They're no longer in the hospital. So how are you going to have these providers now deal with chronic conditions that they've never dealt with before? Over the next 10 years, we have 10,000 baby boomers turning 65 every single day. That's not just diabetes and Alzheimer's, but it's also cancer, organ failure, and transplants. Really complicated conditions that now are being dealt with by nurses. More public access to information. Your patients are coming in with WebMD, Wikipedia, Google searches, Patient Like Me data. You have no idea what they're talking about. And you need to keep up and get this information to the provider. But keep in mind, your medical provider is risk averse. Medicine as a general practice doesn't want to take on additional risk. So all these tools need to keep that really important point in mind. Doctors need one solution. They don't want a ton. They want information that gets filtered and becomes available. Somebody else is ranking it. Somebody else is rating it. They want sensors. They want applications, but they want to know they have the best one. And they want to know that it's trustworthy. So what do we need to do as we create these technologies? We need to think about synthesizing information and delivering it in a way that they can actually use. That's critical. It's really a matter of bringing things together and making it digestible. And remember, with all of this comes a culture change. It comes with some resistance, that we're no longer looking at practicing the way that we used to, and the future of medicine really involves a whole new set of people. But I think today, more than ever before, physicians and healthcare is ready to embrace this change. And I'm really happy to be one of those physicians that's decided to do this with a product of my own. Thank you.
can you talk a bit about specifically like what you see as the solutions to the set of problems that you present?
Yeah. Like I said, there, on a daily basis, physicians get proposed with technologies. Like either the patient will come in with something interesting, a sensor, or they'll want to try to do a study on a sensor. A company will approach them. The problem is to take it to the next level and actually bring it into practice. Really requires synthesizing that information and packaging it in a way that they can compare it to their current practice and recommend it to their patients. And they don't really want to be dealing with 50 different things. They want to have one platform. From my personal experience with the applications that we're creating, I've been told that, 80% of our providers are using Epic. So regardless of what you create, it needs to integrate with our current systems. And that's just the way that, medical care is. It's risk averse. They tend to have one way that they like, and they want things that work with them. And honestly, like seeing people as they went through training, as they came out of training, they're bombarded with all of these things that get thrown at them. Here, you need to spend 30 hours a week logging your interactions. Not only are you seeing 25 patients a day, spending 30 minutes with each of them, but spend an additional 30 hours. So a physician that's supposed to work 40 hours a week, part-time, ends up spending 80 hours actually working. So I think the critical thing to remember is that as we create things, we need to think about the user and trying to integrate our technologies to meet their needs.
I thought it was really curious that you listed technology with a list of providers, and then you said technology, that we need to see technology as a care provider. I was wondering if you could say a little bit more about that and just what your perspective is.
Yeah, I really believe that the information as it comes out, for example, there's 450,000 papers, articles, research that come out every year. For a physician that's, let's say, a nephrologist or an oncologist, to keep up with that data, they would have to go home and read 10 to 20 papers every night. So, and trust me, nobody does that. So what you end up doing is having a big lag between the research as it comes out and the practice that's actually getting done. So I really believe that technology has a big role here. Not only will it enhance and integrate into the provider's interactions, but I think it can actually integrate directly into the healthcare that's delivered to that patient, so that there could be an interface, where a patient can approach technology first, but before it ends up in a provider's interaction. I don't think that we're going to be able to keep up, quite frankly. And I think that we need to start embracing, whether it's telemedicine or it's alternative platforms that come between patient care and potentially refer somebody over to the right specialist. That's sort of like crowdsourcing medicine, things like that are sort of going to be one way to intervene and bring in all this information, filter it out, and then later on maybe lead to that human interaction.
We'll take one more question and then move on to break.
Don't you think that patients themselves actually have an important role in providing care to themselves? I noticed that was actually not one of them.
I absolutely do. I do. My perspective has always come from the provider perspective, because that's my bias and how I think of healthcare, I think of a provider. And also it's very inpatient specific, very complicated care specific. And I think the biggest challenge I see is how do you deal with these patients that are aging, that are much older and have many very complicated conditions in the environment that's really at the forefront, which is you have people that don't have as specific specialty training having to take care of them. So I feel like that's sort of my bias in terms of how I see healthcare.
Okay, thank you so much.